This is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So I'm going to go ahead and another Facebook Live. Complete end block, 42425, initial CM. This is a nice lady, 67 years of age, and she had her first implant was 1983. And then she ended up having them replaced in 2008. She said everything was fine. It had been many years, and so she ended up coming to me with what is a capsular contracture on the right side. I cut out the skin, and as you will see, this is the entire implant capsule that was removed. Now, I assumed that the first one was ruptured. That was a silicone implant. I cleaned out the entire area, so anything inflamed was incorporated along with the implant and capsule as one system, such that all of this tissue that you see at the bottom, if I touch it, it looks abnormal. So I'm going to go ahead and using my sterile gloves and the end block that I removed, you can see how much more compressed this is compared to the left side, which is much more volume-wise relatively bigger. So what I'm going to do is I'm going to go ahead and cut through this tissue just to show you that there is this inflamed tissue. You can see there's like a small pocket that's on the inside, and so I removed this tissue. And I didn't like how it felt, palpated, visualized. So I'm going to go in from here, and as you can see, this is the capsule right here, but the tissue around does not look healthy. And so I removed this tissue as well. Maybe this was part of the silicone that she had that spilled in 1983, the 1983 implant, so I incorporated all of this. Now, she had, interestingly, an MRI done that showed that both the implants are intact. Now, I'm going to still assume that they're ruptured till proven otherwise because they're from 2008. But I'm betting on the MRI it's intact, and given her capsular contracture, so I'm going to go in here. So the MRI is saying it's intact, and I'm going to, with confidence, that it is going to be intact. And as I go in, you can see it is what is an intact implant. I can see, and so very tight, calcified, all badness, inflamed tissue removed, and you can see how it is contracted on itself. Look at the way how it's folded up, because it's like contracted kind of in a very tight ball, if you will. And I'm just going to cut it open so you can see how it was sitting. And look how 1, 2, 3, it's like triangulated on itself. Very hard capsule. I'm having a hard time cutting it open. I'm going to go this way. And I just want to show this is what is a capsular contracture, how it suffocates, tightens around the implant, and causes, if it's a grade 4 contracture, pain for the patient. In this case, she had the 3. And it happened soon right after she got her implants in 2008, this capsular contracture. She went to her local surgeon, who said it's okay to live with a capsular contracture, which is wrong because no one should have to live with it. So you can see how it's folded up on itself. And I'm going to go ahead and preserve it. There is some fluid on the inside. None of it spilled into the chest because this is the end block. And you can see right here, intact silicone implant. This is your .304 Allergan implant. And look at this. And if I may, there is some fluid on the inside. It is not enough to send to cytology. But as soon as I go in, you will see it's very hard calcified. And look at all of this. All of this was contained. None of this spilled into the chest. And if I take my, you can see how hard it is, like the scales of a fish. And if I snap this open, you will see, and you can imagine how hard this was on her chest whenever she gave a hug to someone. And all of this white is going to be looked at by the pathologist. And so complete end block, complete end block. So I'm going to remove my top glove, which is a sterile glove, and I have another sterile glove underneath. And you always want to do it sterilely in case you need to take cultures on the inside. So here's the full thickness skin that helps. Oh, you can see she has some hyperpigmentation here. I'm going to go ahead and send the skin off to pathology just to be absolutely certain she does not have any potential malignancy. I have this tissue that I removed on the side, and again an end block. I removed some of the inflamed tissue that I'm going to send along with the capsule. And overall very happy how everything has gone. Minimal blood loss. And as you will see right here, and as predicted by the MRI, intact implant. And you can see it's folded up on itself. You see how this is? So I'm going to go ahead and pull it out. So intact implant. This is your, you can see how it was sitting, and I'm going to press it. So 304 Allergan implant. And if you look at the fluid around, it has that very slipperiness to it. I'm going to invert this tissue so you can see the capsular tissue. It did not calcify like the other one. Some areas so thin. If I put it on a ruler, you can read the numbers like 13. So you can see how thin it is. And no matter what, how thin, the entire implant capsule is removed. And so there you have it, end block, the gold standard. And I'm going to send these off with the patient. So end block, the gold standard. If there was any fluid, none of this spilled into the chest. The capsule, implant, all inflamed tissue removed as one piece. So the implants will be returned to the patient. Capsules to be sent to pathology, rule out the BIAL, CD30 analysis, rule out lymphoma, rule out malignancy, cultures for aerobic, anaerobic, and fungal, and most importantly, we'll see how the patient does post-op, given her many symptoms. This is a nice 67-year-old lady from Ohio. She actually is very well versed on how I do the surgery. She did her homework. She talked to 7 plastic surgeons before she made up her mind. And she speaks very eloquently to the point where she's going to be our Facebook guest live in the next week or so we will hear from her directly. This is Dr. Khan, Executive Plastic Surgery.